Ohio continues to be in the national spotlight regarding the opioid crisis. Tackling the issue is a top priority for Governor Mike DeWine and the state.
Dr. Suprenant from Buckeye Health Plan is here to talk about prescription drug abuse and prevention. As Zach just mentioned, we know that the opioid crisis has hit the Buckeye State hard. So why was it important for Buckeye Health Plan to be a part of this effort?
Well, as you're suggesting, Ohio has been actually one of the top states for overdose deaths several years in a row. So as part of our commitment to transforming the health of the community one person at a time, we're promoting healthier use of medications and supporting people with a drug addiction problem.
Yeah, the big question you got to ask yourself is, why the Buckeye State? Why is it this area that is affected? I'm just reading that some people are more susceptible to addiction and to getting addicted to opioids. Why is that?
Well, you're absolutely right, Zach. About 50% of the reason is believed to be genetics. So if you come from a family where addiction problems run in your family, then you're at very increased risk. The other 50% is primarily environmental factors. So those can be underlying behavioral health disorder like anxiety or depression. It can be adverse childhood events like being molested as a child, things like that. And then people who are exposed to drugs and people who use drugs then are at increased risk as well.
So what can we be doing on a daily basis to help?
I think we need to all be vigilant, be looking at the people around you and be concerned. If you notice changes in their behavior or in their physical status that would make you suspect that they are having a problem, then you want to help them seek treatment right away. There are really excellent treatments available, but people just need to access those.
And here's some of the physical changes that you'll see right there: confusion, decreased breathing, itching and sweating. Really, the list goes on and on. I want to go back to what you said just a second ago about half of it is genetics for people that have a history in addiction. Is that something that can be altered or changed through some sort of therapy or anything like that?
There's no way to change your genetics. I think what I tell my patients is be very vigilant and tell your family members to be very vigilant. So most of my patients already have an addiction. I have an addiction medicine practice, and I tell them to talk to their children because their children are at increased risk. Other family members are at increased risk. Even a family member of a smoker that's considered an addiction, and they're at increased risk.
Well, there's a lot of things that a lot of local law enforcement agencies do now. They have the take-back days, and really any day you can go dispose of those prescriptions properly.
It's an excellent point. So disposing of medications is a huge thing. I talk to patients all the time. They want to save that medicine for some time that they need it in the future,
right,
which is inappropriate use. They really need to be disposing of any unused medications. Of course, controlled substances, but other medications as well, even their antibiotics and other medications that they're no longer using, they should be disposed of.
Yeah, and of course, we really just want to hit on, if you notice anything, do something. If it's a loved one, of course, here is the behavioral changes that you might see. Change in peer group, careless with grooming. You can see missing classes or work. If somebody's not acting like themselves,
right,
it's a sign.
Absolutely, that's exactly it.
And they can contact you guys for more information and help?
BuckeyeHealthPlan.com, or they can contact our member services if they need a referral to a specialist.
Wonderful. Great resource.
Great seeing you as
Thank
always.
you.
Thank you so much.